When you eat food, it doesn't typically release dopamine in those reward regions. It's really only the very first time you eat a new food. And that has more to do with dopamine signaling as a part of the learning process and just, making sure that this food doesn't make us sick and being aware of our surroundings. You take high sugar foods, that's a very different story. It releases dopamine like a drug.
Travel, as I was mentioning earlier, we travel a lot, and going to a lot of these, we traveled to Latin America earlier this year. We were in Japan over the summer as well, Japan and South Korea, and we realized, there are plenty of uh, access. There's plenty of access to sugar in these countries, no doubt about that. And human beings, to your point, they're also predisposed to wanting some of that. But we find people are still healthier in those countries. People are still behaving in a more responsible manner because, first of all, they've got the understanding, they've got the education about the ill effects of sugar. But then the industry has done a good enough job from a responsibility perspective and say, hey, whatever we do make, whatever we put on shelves, whatever we put in packages, it better convey the right message and also be in moderation enough to not have those spikes, not have those craving centers fire up left and right. And yeah, I'm glad you brought that up because I was thinking about that. I was like, man, why is it that people over there have the same access, but
Yeah.
yet we as a society, us as Americans, we're struggling more than any other country. But I guess that's a much longer systemic discussion to worry about.
Yeah, I do think there's a cultural piece to it too. I do think that in a lot of other countries, people are very much wedded and dedicated to their food culture and the
Mm,
traditional foods of their culture.
mm,
And that's where Western influence is starting to become problematic in many countries. I know, for example, a couple of years ago, I was invited to speak in China to an organization there that was concerned about the fact that many of the younger people in China are not cooking traditional Chinese food at home, which has been,
yeah.
a big part of their culture. And with the influx of, fast food and a lot of this Western influence in terms of processed food, it's changing the composition of the types of foods that people eat. But I think if you look at America, I feel like our cultural identity is junk food. I mean, I feel like it's become that, and I
Yeah.
don't think that we have as much allegiance to home cooking, and maybe regionally we do in certain parts
Yeah.
of America because America's a very regional country. But I don't know. I just think that that's a big part of it, that we don't have that sort of historical tie as a nation to eating healthy and these sort of foods that we know are nourishing and a big part of our history and culture that other
Yeah.
countries fortunately do have. I think that's helping them.
Yeah, it's interesting you say that. So I grew up in India, and growing up, when you were traveling, when you were out with your family, mom, dad, me, and my brother were traveling, and you got hungry, and I told mom, hey, we need food. I'm hungry. There was no, hey, let's just take this exit, go grab a burger and fries, and we're
Hmm.
good. It's like, hey, I'm gonna cook when I get home, and when I get home, we'll cook a meal, and we're gonna have the meal, right? So first of all, you learn sort of that delayed. It's
Yep.
okay for me to be a little bit hungry. I can wait to get home. And second was when you got home, that's when you got the home cooked meal, and you stayed away from that. But the last few years I've been going there for family trips or vacations or whatever the case might be, the prevalence of these fast food restaurants that have popped up and the Uber Eats, and we're making access to this junk faster. It
Mhm.
was already fast because it was
Mhm.
called fast food to begin with. Now it's like, hey, not only is it fast food, but we can get it to you faster too. You don't even have to get off your couch and go get the food. We'll
Right.
bring it to you for you to get unhealthy. And as a result, I think at this point now, India has the second highest rate of diabetes
Yeah.
in the world, and
Yeah.
it continues to get worse. And I'm afraid that this trajectory, obviously, we've seen it in the U.S. already from an economic perspective. $400 billion problem. I mean, diabetes is a $400 billion issue for for our society,
Mhm.
and then you start adding in some of the other factors and some of the contribution to other diseases
Mhm.
based on diabetes, my God, it is a multiplier that the magnitudes are enormous.
Yeah.
What's been your experience? What do you see in that, or what's your opinion on that as well?
Oh, yeah, and it's the thing is too, you don't if you diabetes can be well managed. People aren't going to die prematurely from diabetes. The majority of people are able to live a long and you know long life with diabetes,
Hmm.
which means that they're going to have to manage that for the rest of their life. So we're talking
Hmm.
about people living into their 70s and 80s, and we're talking about a lot of people.
Yeah.
So the costs alone of managing diabetes, managing the complications that can arise, and like you said, the contributions that we see from other conditions like heart disease,
Yeah.
all are really should be setting alarm bells off for countries, because to be able to support the health needs of a nation of sick people
Mm.
is really, I don't think, sustainable for any country. And so when we're talking like in the US, upwards of 60% of the country being able to be considered obese, and those numbers are just continuing to rise. We're seeing, the numbers among children are going up. The trajectory that we're on is very dangerous. And the thing that has been really frustrating for me as somebody who's been, studying this and doing research on this for a while now is that we have part of the answer right in front of us. It's really just about cleaning up the food supply and
Mm.
changing our mindset around what we eat and what kinds of foods we should be eating and promoting as healthy. It's not going to cure all diabetes. It's not going to get rid of all
Right.
cardiovascular disease, of course, but we could put a significant dent in it.
Yeah.
And to me, that alone, I still don't understand why the insurance companies haven't picked up on that, and why there's resistance to doctors prescribing like fruits and vegetables, like
Right.
having those be $3 to pay for when you pick them up, as opposed to paying a $3 copay for your medication that you're now going to have to be on for the rest of your life. So I do think that there is a lot that can be done when it comes to food that could help mitigate a lot of the suffering that we're seeing. And I do have concerns for countries like India and other nations that just don't have the infrastructure to care for
Yeah.
all these people who are going to get sick.
Yeah. Yeah. No, it's interesting you said that, because I attended a sort of a panel discussion conference this past weekend. I live in Dallas, and there was a state of diabetes that American Diabetes Association had put together, and there were a bunch of panelists on the stage: physicians, care coordinators, community workers, so on and so forth. And the biggest thing it kept coming back to was the conversation about nutrition, right? That, hey, the ability for people to get the right education about nutrition and have then access to those nutritional options, right? The food deserts that we talk about, because
Mhm.
a lot of the lower income community, a lot of the minorities, for example, or the African American or Hispanic community, Indian community for that matter, we are already predisposed to being to have a high risk of diabetes. And then on top of that, if you take a low income subset of our American society and say, by the way, we know that you are at a high risk, but also here's some more fast food to go fix your hunger, right?
Right.
That's just it's Ouroboros, for lack of a, just a snake eating itself, right? It's just a never
Mhm.
ending loop. It just keeps going on and on. This brings me to the next topic, which we keep hearing over and over again: the GLP-1 drugs,
Mm.
right? And the GLP-1 drugs have become very, very popular.
Mhm.
There's been this new push for bringing down the cost, and I'd like to kind of share our thesis, and would love to get your points, valid, invalid, from our thesis perspective. Would love to hear your thoughts. So, in our opinion, GLP-1 drugs, obviously, there are people, there are patients that need it, absolutely have a need for it, and should be getting it, but at the right cost, the right structure, with the right sort of protocol for the dosage and use of it. But it has become sort of a band-aid right now for a lot of people, and they're rushing to GLP-1 drugs to say, hey, I don't really need to change my behavior. I don't really need to change what I do, how I do it, because I've got this, in their mind, a panacea that can just cure all, right? And now with the drug costs coming low, but bringing it down again, which helps a lot of people. It should help a lot of people. But my fear is all of a sudden we've made us even more unhealthy, because now we're saying, hey, guess what? Remember that thing that was expensive that might have been the reason why you didn't use it? Now it's even cheaper. So you still don't have to do any effort. Now go enjoy your life. Don't change your behavior. Don't change your nutritional habits, because, well, here, there's this thing right there that can fix it. Is that, what's your thought on that? How do you think about that?
Yeah, I agree. There's some concerns because I think that the drugs should not be viewed, no drug should be
Mm,
viewed as a panacea, right? I think
mm,
that, you know, like even if you have a fever, right, and you
mm.
need to take Tylenol to reduce it, all
Good
right,
point.
you also need to rest. You also need to support your immune system because obviously your body is fighting an infection and you need to, get fluids. Like, so it's not like you just pop the pill and be on your way. You have to do the
Mm,
other things. And I think it's the same when it comes to the GLP-1 drugs. I think they're a tool that can be used along with other tools in the
mm,
toolbox. And I do think that if people enter the journey with the mindset that I want to change my behavior, I want to make healthier choices, I want to eat things that are good for me, I want to be able to indulge in little bits of sweets here and there and not have to
mm.
overdo it. If that is the mindset and that is the goal, I think that the GLP-1 drugs can be helpful to get people on track. They can be kind of like a tutor, if you will, because they're going to, just by the nature of how they work, not allow you to overeat. But I think, to your point, when people go in with the mindset of like, oh, now I can just take this drug and I don't have to do any of the work or any of the mindset changing that has to happen, that's dangerous because you could go to the pharmacy one day and they might say, we're out of your GLP-1 drugs, which is happening. I mean, you hear this all the time where, there's been shortages or, people like, have to fight with insurance about getting them to pay for it or things
Yeah.
like that. And so I do think that, we do need to be better about educating people around the goal of this, which is to
Yeah.
be healthier. And yes, you could use these drugs as a foray toward that, but I really don't think that should be the end all. I think it really
Yeah.
should just be the beginning. And learning how to eat differently, learning
Mm.
the choices to make can be done. It's just a matter of a lot. And I think taking advantage of the fact that when people utilize these drugs, it kind of does give them that pause so that they can think twice before they go and overeat something, or think
Yeah.
twice before they, choose to eat something that's really not that healthy. So I think putting the mental work in with that is important. And I think more people need to do that.
Yeah, you talked about education or educating people about the responsible behavior. At the conference that I was at, and I'm looking at some of the stats that I came across, and one of the questions that ADA had reached out to people in their survey and asked them about what are the desired insurance benefits changes that you would like to see. The number one, the number one thing that people said at 58% was add coverage for diabetes education.
Mm.
So people are starting to wake up to this and say, "Hey, I get it that I have access to these drugs," and I'm glad that I'm seeing that the people are saying we need more education. But that's the probably the most foundational, fundamental thing that people need,
Mhm.
the empowered education to say, hey, what's right or what's good for you, what's bad for you, how does it affect your body, how do you overcome that, right? Those are all parts of education. And what if you go down this path, where does that lead to? I think it was refreshing, and you echoed the same sentiment, which is education, education,
Mhm.
education is a very, very key feature.